the myelodysplastic syndromes, a quite difficult area of bone marrow failure syndromes that can over time evolve into acute leukemia. We're focused on translating discoveries in molecular genetics into novel therapeutics and collaborate quite closely with laboratory-based investigators. One of the areas that we're investigating is how MDS evolves over time with respect to the molecular biology. What genetic changes are acquired as the disease moves from a lower risk form to higher risk form to acute leukemia. We're also studying this not just in garden variety de novo MDS, but in MDS that arises from inherited bone marrow failure syndromes. And on the clinical trial side, I'm leading a study, a multi-center study, in which we're using the first targeted splicing inhibitor in myeloid malignancies. One of the most difficult situations that we encounter is when a patient who may be older than age 70 has a low blood count and the diagnostic evaluation, including bone marrow biopsy, does not show a clear diagnosis. We've really begun in the last 2 to 3 years to incorporate molecular genetic testing routinely in the evaluation of these patients. But we've learned that by age 70, 10% of patients who are healthy and have normal blood counts have an MDS-associated mutation detectable in their blood. They do have a risk of going on to MDS. They do have a risk of going on to develop cardiovascular disease, but most people are never going to have any problem related to this. We've called this state clonal hematopoiesis of indeterminate potential, or CHIP. The acronym ICUS, or ICUS, is used to describe patients who have idiopathic cytopenias of undetermined significance. These are patients who have a low blood count, have an evaluation for it, and there's no specific cause identified. If a clonal mutation is detected in one of those patients, we still don't know whether they have MDS, but they clearly do have a clonal population, and so sometimes those patients are described by the term CCUS or CCUS, clonal cytopenias of undetermined significance. Finally, some patients just have abnormal cells on the blood smear, such as pseudopelger-Hewitt cells, yet they don't have any cytopenias and no evidence of a disease. They're sometimes called idiopathic dysplasia of undetermined significance. All of these potentially can evolve to World Health Organization defined hematologic malignancy, but many individuals who have these findings are really not sick. They don't have a disease per se. And distinguishing when it's ICUS, CCUS, IDUS, CHIP, or myelodysplastic syndrome is a major area of research investigation for us.